Supporting safe consumption sites. Introduction. Safe consumption sites have become a popular controversial topic in society. While safe consumption sites may have numerous benefits, there have also been many challenges encountered throughout the growing number of safe consumption sites. While safe consumption sites continue to grow, the topic is thoroughly examined to determine the benefits and outcomes of these facilities. This project will examine how safe consumptions are beneficial in many areas. The purpose of safe consumption sites. Safe consumption sites allow for drug users who inject or consume drugs to do so in a clean, supervised facility with drugs they have pre-obtained. These facilities provide sterile supplies such as syringes, as well as emergency care in cases of overdoses or injection site infections. Care providers at these facilities are also provided education in regard to drug use in addition, as well as referrals to other healthcare services or treatments. The qualified staff assist users by providing proper dose to minimize overdoses and ensure sterile supplies are used, as well as knowledge on how to safely inject oneself. Wood et al., 2006. Safe injection sites can also reduce the strain on emergency services by limiting overdoses and ensuring naloxone is administered when needed. Reynolds et al., 2022. Substance abuse and safe consumption sites. Illicit drug use is a growing issue in today's society, and it's important that harm reduction strategies such as safe consumption sites are put in place to combat the issue. Safe consumption sites are one strategy that is effectively helping our communities and drug users. Vancouver opened the first safe injection site in North America in September of 2003 as a pilot study funded by the government for a 3-year evaluation. Wood et al., 2006. In 2016, British Columbia declared public health emergency due to the ongoing opioid crisis. 1,148 deaths related to opioid crisis occurred in British Columbia in 2017. Patterson et al., 2018. Based on Patterson 2018, injection was identified as 32.8% of drugs administered in overdose deaths and 30.6% oral drug administrations. In June of 2017, Health Canada's safe injection site progress continued, and SafePoint and Surrey began supervised injections and later in the month received approval for oral consumption. Patterson et al., 2018. Safe consumption site health benefits for users. Safe injection sites can have many health benefits for users by providing proper knowledge by reducing the risk of infection and overdoses from illicit drug use, such as HIV and hepatitis. It is important users are educated on such risks and know what precautions to take to reduce the risk of transmission. 30% of users attending safe injection sites from May of 31st, 2003 to October 22nd, 2004 expressed they felt well educated on safe injections. Wood et al., 2006. Woods also stated that in Vancouver pilot study, 95% of users who visited safe consumption sites were happy with the care they received. Safe consumption sites ensure users receive quality medical care and help manage overdoses. Staff assist in ensuring injections are done safely and a safe dose is administered to prevent overdoses. And in the case of an overdose, staff is readily available to help the individual until emergency services arrive to prevent fatal overdoses. Levingood et al., 2021. Safe injection sites also help ensure users are provided with naloxone kits and are provided the education on how to properly administer in the case of an emergency. Kennedy Hendricks et al., 2019. Education benefits for users. It is important users provide a proper education on drugs to ensure their safety. Safe injection sites provide users with appropriate information on drugs and drug use, safety, overdoses, where to find support, health addiction support, and other services to ensure that users are informed and equipped for emergency situations, such as what to do in the case of an overdose, and ensure users receive proper training on how to administer naloxone. Kennedy Hendricks et al., 2019. They provide information on diseases users are at risk of in regards to transmission, the importance of clean supplies, as well as where to seek proper medical assistance in the case of a suspected transmission. Medical staff at these facilities help provide information and connections to many health services that may be needed. Kennedy Hendricks et al., 2019. Harm. Social harm can be a result of public drug use, and safe consumption sites can assist in reducing the risk of social harm by reducing public consumption and the amount of drug and drug users consuming on the streets or at our parks and neighborhoods where vulnerable people such as children are. By reducing public consumption, it also reduces the risks that come along with public consumption, such as drug paraphernalia on the streets, reducing drug-related crime. This will increase user and public safety. Surrounding neighborhoods of safe consumption sites reported less public drug use since the opening of facilities. Kennedy Hendricks et al., 2019. Stigma. There's a significant stigma around drug use and those who use drugs. Society has placed stereotypes and negative views on individuals who use drugs, and this often deters them from seeking the care and services they may need. The stigma around drug use creates feelings of shame and barriers for drug users, deterring them from seeking the care they may need or want, because they fear they may be judged, shamed, or turned down and not provided adequate care. Safe consumption sites can help remove such barriers by providing a safe space for users to seek the adequate care they may need. The medical providers and workers at safe consumption sites also help push past these barriers, ensuring users feel heard.